Hey, how you doing today? What brings you in?
Um, so I've been having headaches, and
Okay.
it's very unusual. I only get a few a year.
Mm-hmm.
I've had this headache for 3 or 4 days now. I've blacked out twice.
So there are visual problems.
Yes.
Are you phono and photosensitivity, light, sound?
Yes.
Okay.
And then also this weird bruise right here.
Okay. Does it hurt?
Yeah.
Okay.
And then I mean that's about it. But all this has caused me not to be
How
able.
long have you been dealing with the bruising? You said 3 or 4 days for a headache.
Mm-hmm.
Okay.
About a week for all the symptoms
Okay.
total.
Are you unusually thirsty?
No.
Okay. Anything change in your dietary habit?
Nope.
What kind of medications are you taking?
I
And I
mean,
mean over the counter.
I mean
Are they?
just the like pain relievers you can get anywhere.
Okay. Oh, so OTC over the counter.
Yeah.
Okay. All right. Um. All right. Well, the nurse is going to come in here and draw some blood.
Mm-hmm.
I'm also going to get a CT of your brain,
Okay.
and if everything checks out, we can probably get you out of here. But I'm a little concerned about. Um, there's a couple things. I'm going to do a Chem 7, which is a metabolic panel, and
What is
I'm
that?
also. Well, basically, we take a few vials of blood, and we're going to check it just to see if the your liver count, ALTs, ASTs are within range, and I'm looking for a couple of things that would match your symptoms. That's obvious what you're saying. The headache, we'll rule out anything neurological, and then we'll go from there. Okay?
Mm-hmm.
All right. So we'll be right back.
So I was
What's
trying to
what's
figure
going on
out.
with the blood test?
Well, I was trying to figure out what is going on because his liver count is extremely high.
Let me see the results.
There you go.
Um,
I've never seen it that high before, especially
did we get
with
a
a person that.
troponin count as far as the cardiac enzymes?
Yeah.
Was it within range?
That was normal. This was not,
Yeah,
which
this
is
is
weird.
twice the normal range.
Which is weird, and especially for a kid that young. I mean, he's only in his early 20s, so.
Maybe if we go by what he says, we'll check the varices, we'll scope that just to make sure that it's not an alcohol-induced type thing.
Mm-hmm.
He says he drinks on the weekend, and you know what I mean. He's 20. Kids, he's 23, so I really don't think that that's going to be an issue. But we'll make sure that that's not the case.
All right.
Why don't we do a let's do a scope, and then what we'll do is we'll make sure that that's not good. That's not the problem. Make sure he's not. We
Well,
forgot a few things.
what do you think it is right now?
There's only a couple things that's going to cause that
Yeah,
type
that
of.
the one thing that's weird to me is that bruising. I've never seen a bruising like
Yeah,
that
well,
before.
the bruising can be caused by a couple of things. I want to do a
Wait,
CT
we
just
haven't
to make
asked
sure.
if he fell.
If there was any trauma.
I mean, that's a big ass bruise, so he must have fell pretty damn bad.
Let's go back in the room. I got a couple questions to ask him. Ask you. You said you only drank a few beers. And we're looking at your liver count, and I'm going to be very, very forward and honest with you. That only happens. Do you take a lot of acetaminophen, Tylenol?
Not really.
Okay.
I only take it a few times a week.
Okay.
Yes. I mean, I've taken it a lot lately because of the bruise.
Okay. This is going to be more than 4 grams a day. I mean,
How many is 4 grams?
it'd be 4,000 milligrams of
Oh.
acetaminophen, and that would be like taking 500 milligrams,
Oh,
and you don't.
no.
Okay. How much do you drink? Just be honest with me.
once, maybe twice a week.
Okay, so
Barely.
you're only drinking on the weekends, just having a few beers with your friends?
Yeah.
That's not going to cause it either. I'm talking about drinking every day. So, all right, thank you. Are you a smoker?
No.
Okay. And again, this is between you and I, any recreational drugs?
Only if it was legal.
Gotcha. Too bad it's not.
Anything else?
No.
Have you guys like found anything strange other than
Well,
the liver thing?
The liver count was twice the normal range. The bruising. Yeah. Do what? Oh, we just got your CT back. So excuse me 1 second. I'll be right back in your room, okay? Just give me... Okay. Okay. Thank you very much. I appreciate it. Okay. You have an adenoma on
What?
your pituitary. You have a small microadenoma on your pituitary. I'm not sure what that means yet, but we're going to look into it, and then what we're going to do is we're going to call a neurologist in, and we're going to get to the bottom of it. But this one is just, you got me on this one. I just don't know what the hell's going on. I don't. So let me go talk to the neurologist, and we'll be right back in, okay?
All right.
All right, thanks. Yeah.
I got the results back to the CT. I want you to look at this. How is that possible? If he has all these high counts, there's nothing on the CT.
Hyperkalemia? The potassium shouldn't be that high either. What the hell?
I don't know what the hell this is.
God. What is this kid doing? Okay. The neurologist said two things. Number one, they can get the adenoma.
Oh, that's good.
But if this is caused by something else, we need to look at every organ in this kid's body. I want a CT, I want a chest x-ray, and I want a CT. Head, neck, thoracic area, I want the whole shebang.
Alright, so he's our guinea pig for the next few days.
He's going to be here for a while. Until I can figure out what the hell is going on. Give me a little
Whatever
bit.
he has.
Right. Give me a little bit. I got to go think. Hey, didn't you say about 2 weeks ago this kid was blacking out?
Yeah. He said he started blacking out about 4 days ago. Well, now it'd be 5 days since he's been in here for a day.
We've got a new symptom. He told me 2 weeks.
Yeah, but what causes blackouts for a person who's healthy?
I don't think it's the adenoma on his pituitary. I don't.
Well, that's causing something.
I get that.
Yeah. But what is it causing?
Why? I have no idea. Bring that neurologist in here now. Go get him.
Hey, Jack, come here.
I could have done that.
I know. Come here. He wants to ask you something.
When you took a look at the CT of his brain, you said you saw a lesion. Where'd you see that lesion at? Okay. Because can't stop thinking about that bruising. The bruising has got me. The headaches and the bruising together.
This is what happens when you bring your office to your own house.
Yeah. I got an idea.
Does it involve curing this kid or just another symptom?
No, we're gonna cure him.
How?
Let's go talk to the kid. I got an idea. Listen, when you started getting these headaches,
Yeah.
did you know that they were coming on? Or did you just get the headache and it was just blinding and you had to be in a dark room?
It was sudden. Like, I would be doing something
So
perfectly
it was
normal.
an acute attack. I mean,
Yeah.
it came on and just
Yeah.
hit you like a ton
Just,
of bricks.
yeah, just immediately.
I think I know what this is.
What?
I think it's Cushing's.
Cushing's? What the hell's that?
Cushing's, it's
For a pillow?
disorder. For your age, females get it 2 to 1. And
Why?
it's just, I think it is. I'm not sure yet.
Is there a test to make
Yep.
sure? But how could I have gotten it?
The neurologist is going to confirm for me.
No, where could I have gotten this from?
Congenital.
Wait, this is
You were,
born with it?
Yeah.
But how did it come on just now?
you were just, it reared its ugly head. That happens. I mean, people get the symptoms that you get, and I think we nailed it.
How do you get it?
It's, the neurologist can fill you in, but I'm
No, but what?
pretty sure you were probably
No, but what exactly is Cushing's?
Cushing's disease. We've confirmed it. What they can do is it's an adenoma, and it's an overproduction of corticosteroids. And what happens is that when you've got the round face,
Mm-hmm.
excessive fat in certain places, the bruising, and it's petechial in that area. It's the rash that you get. So what they're going to do is they're probably going to remove the adenoma, and if they have to, then they'll remove your pituitary. But the doctor seems to think that he will be able to remove the adenoma and not have to take the pituitary.
Will this be a cure, or is this just going to
This will
control
cure
it?
it. This will cure it. Yes.
So I'll be fine after this?
You're going to be fine. You're going to be a regular 23-year-old, and that's it. So
when will I start to feel better?
you're going to start to feel better by tomorrow. They scheduled your surgery tonight, and the surgeon said it would take about an hour and a half.
Okay.
So I'll be there,
All right.
and we'll get you prepped and get everything and get you underway, and we'll you'd probably be here for 2 to 3 days afterwards, post-op, and then we'll go from there. Okay?
All right.
All right, my man. Yeah.
You have a phone call.
Oh. Yo. Yeah. How you doing? How's your vacation? Wait a minute. Slow down. Whoa, 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 whoa. Slow down. Slow down. What now? Did you see anybody? No, I've been here all day. We had a case of Cushing's and a 23-year-old. Okay, listen to me. Where are you at right now? Get your ass in here. Don't touch anything, and I'll make the call. Just get your ass in here and be safe, all right? Anybody approaches you, call 911. Right. Alright, I'll see you in a little bit. Bye. You're not gonna believe this.
What?
The son of a bitch left a note for her, and there was blood all over the note.
Well, nobody here is gonna do anything. We just have to take care of this ourselves.
I thought this would be over.
It's just. Well, now it's just. Now it
Just
feels like
started.
It's just the beginning.